So, now Usman and I will take questions. And I just want to close off here is, thank you for your time. I know that in the beginning the camera was shaking a little and the voice wasn't too good. So apologies for that. Hopefully it's good now. So I hope with this, we try to empower you as to what you can do. I understand there's a lot of stuff now that we don't know, but what we know is easily applicable. Just remember the do's and don'ts and please apply. Rest we don't know. Best example is this. Just think of a weatherman telling us that a big blizzard is coming or has come. Sometimes they're wrong. We want this situation when they're totally wrong. But what if they're right? We have to be prepared that they are right. And that's what's being done right now. So we don't need to panic. We don't need to be hysterical about this. As faith-based community, we know if it's going to happen from a creator, it's going to happen. On the same token, we need to have the knowledge. What can we do? And hopefully with this talk, Usman and I try to give that to you and you'll be able to implement and just help one another and pray. With this, we'll open the floor. We'll take questions. So we have someone here, and then I think we understand you can send by WebEx or through Facebook. So we have a question.
Okay. Don't see any questions here. Let's see. Folks can send questions through the chat window.
So we have a question here from yes.
Yeah, my question is, you said that the mortality rate is about 2 to 3%. But this virus is spreading much faster than any of the other ones, SARS and Middle Eastern flu. So do you think, the total mortality rate on this one, because of its spreading and it's so contagious, is going to exceed the other viruses in the past?
So that is one.
Please repeat the question.
The question that was asked is that at this point, the mortality that has been calculated is much lower than the mortality for SARS or MERS. COVID-19 mortality is only up to 3% as opposed to SARS, which was about 10%, and MERS was up to 35%. And the question was, can it exceed those two previous viruses? It is an evolving situation. It may exceed. But so far, what we know, the way virus is behaving, and we have a big cohort to predict. A large number of mainland China was infected, followed by Iran and Italy, and that has shown recovery already. So we have decent amount of data to predict that its mortality is going to stay lower than SARS or MERS. One point I wanted to add is that transmissibility is that what's scaring everyone, because it has higher transmissibility rate, which is causing illness in a wider population compared to those two, because they were so fatal or lethal viruses that they used to kill people before they could transmit to others. And the other factor is their incubation period of this virus is longer, so you can transmit the virus to others before showing the signs and symptoms. But I do want to emphasize on this point is that the transmissibility or the contagious state of this virus is most when you are symptomatic. Yes, you can transmit the virus to others while you are asymptomatic in prodromal phase, but it is less likely as opposed to when you're symptomatic. So that is a big reassuring thing. People should understand that people are not walking in the community transmitting this virus right and left. That's not happening. It can happen to some extent, but it's not happening. It is when one becomes infected and starts showing signs, sneezing and coughing, that's what they're transmitting the virus mostly.
The travels were not banned then and the schools were not closed then, so the transmissibility is the reason it is so fast. That's why all the travel has been banned and schools have been closed.
Right, so these are the containment procedure. They are trying to contain the virus so that it does not spread at a fast pace.
Okay, so there is a request from a community member to share the presentation slides with the community, or at least the hotline number.
Okay, we will.
Okay, and then the next question, please ask how someone quarantine themselves from their families if they are exposed, if they are PUI, patient under investigation, or should they or only quarantine from friends, family not living at home?
So the question is, how does one quarantine themselves if they're in contact with someone?
Yeah, quarantine themselves from their families if they are exposed.
So we had a slide here. Maybe if we can go back. So we'll put it up again. We went through that, but it's good to go over one more time.
Which one?
So I think yeah, you can do this. That's good. So really, the best way to do it is this: if you are trying to protect, I think the best way is you need to stay in a room by yourself. Do not share your personal items with anyone else. You need to wear a mask. We need to minimize contact, so no more guests coming. And I think if you follow these three, on top of that, make sure you wash your hands multiple times, maybe 10 times a day, and wipe all the commonly touched surfaces. That's the best you can do in terms of quarantine. Again, just keep yourself within a room. No one should come inside your room unless they have to. If someone comes in, you have to be masked. Wash your hands, commonly surface again, wipe them many times, and hopefully it should help not spread the virus. And up to 14 days. Right now, the recommendation up to 14 days, 2 weeks.
Next question. Flu season ends by April. Will COVID-19 subside by then?
We can't tell this with surety, as again, this is an evolving situation, changing every day, and it's a new mutation, new mutant virus. We don't know about this virus. We can compare its behavior from its siblings. SARS-CoV virus 2, SARS-2 virus is behaving very much similar to SARS-1 in many ways and in many aspects. And that is why we believe that it should subside when the season changes. Whether it will, at CDC website, we do not have that information, whether this virus will be killed by hotter temperature or disappear in summer. It may or it may not happen.
Another question. Does zinc pills help cure or contain the COVID-19 virus?
What?
Zinc.
Zinc.
So, no, we don't know this point in time. So you might have seen a lot of recommendations that you need to eat zinc, iron units, vitamin C, water. Those are general measures that are recommended for patients for any viral illness. There is no known sort of effect that we know of zinc during this virus. So, no.
Okay. Next question. Are there any type of foods or vitamins to boost immunity against the virus?
So, recommendation is vitamin C, vitamin D, and drink plenty of fluids. And the rationale of fluids, as I say, is this, that we know this virus stays in your nose and throat. So when you drink water multiple times, it washes your saliva and the secretion from your throat into your stomach. So that's the rationale of drinking fluids. So, and that holds true for any viral illness as well.
Any other questions?
No, there are no questions on the WebEx.
So I think if there are no questions, I want to thank everybody for your time. Thanks for listening. Hopefully it was helpful. And those who know us, those who know ICN, they can post questions. I guess there's one more.
There's one more question. This one is actually, I have heard Tamiflu has shown to be effective against COVID-19. Is there any over-the-counter drug comparable to Tamiflu?
No, Tamiflu has not been shown to be effective against COVID-19. That is a fallacy. Again, this is what's going on in social media. People are forwarding unverified information. Tamiflu is not even a treatment for seasonal influenza. It does not cure the infection. It shortens the the course of infection in influenza, and it has no role in COVID-19 so far. At this point, as Dr. Atif mentioned, there is no treatment of COVID-19 except frequent hand washing and self-isolation if you have been diagnosed with it. There is nothing else you can do.
One more question.
Yeah, I have a question about the testing. Looks like there's no testing available whatsoever. Generally, and also, can you shed some light on the vaccine that I heard is not going to be developed in like a year and a half?
So the first question is about the testing. So testing has been available. It was limited and restricted. To give you an idea perspective, the hospital called Rush Copy in Aurora, until 2 days ago, they only ran 4 tests. So they were very limited as to how many they can do. Otherwise, we're getting phone calls, everybody walking in, I have coronavirus. So we were really restricting as to who, with following strict guidance, so test was there, but very limited. But after Donald Trump's speech today with national emergency, we've been told that by Tuesday, it will be readily available. They are going to be very flexible with who we test. So they will be testing a lot more, I think, starting Tuesday, next, coming week. So that's that. And your second question was vaccine. Typically the way vaccines work is for live viruses, they inject the live virus into either a rabbit, rat, or a horse. And then they make antibodies, then they extract that, and that's used. Of course, I said this in 30 seconds. In reality, 2, 3, 5, 6 years it can take to develop a vaccine. You're right, so far, I think the best guesstimate is 2021 early, we'll have a vaccine. Of course, with being a national emergency, a lot of funds is getting pumped towards this. We hope and pray it'll change, but again, as of earlier today, vaccine is going to be 2021, March, April time.
One more question. Will you have testing available at your free clinic at any time soon?
I don't think I can answer that question at this point in time. It all depends. We hope and pray that we can curtail and control it, but if it gets out of control, that they're going to have multiple access points, things like that it might, but at this point in time, I don't foresee that.
So the issue is the kit is not available, or it's so expensive, or what's wrong with testing more? Is it?
I think what we were told that we had limited kits. So again, Roche will be making a lot more.
Uh-huh.
In fact, Donald Trump announced in his speech today that they've contacted Roche, and Roche said they will come up with, maybe hundreds of thousands of kits by Monday, Tuesday. So I think if we had said around 9:45, we're almost there. So I do want to thank ICN for allowing us to do this for the community. And again, the main purpose was for you to be aware and do your part, which is, I had a slide with you, you'll have it, inshallah. And then please do not panic. And those who know us, you can reach out to us. Those who don't, reach out to us in platform. And so thank you so much, and Dr. Small.
Thank you all who joined us tonight, and I hope this was helpful and we were to some degree successful in removing some of the concerns and the anxiety among the community members. And who joined and learned something, I request them to forward this information to their family members and friends so that some sense prevails on social media. This is my message. And we have this available for another session if requested.